If your parent is taking 10 or more medications, there's something you need to know. More pills doesn't always mean better health, and it might actually be making things worse. Hi, I'm Suzanne Fasilla, and I'm founder of CaregiverHaven.com and the Haven community, where members work with me on their special challenges. For 25 years, I've helped seniors and their families navigate aging as a physician assistant in geriatric care, emergency medicine, and urgent care. So if this video helps you, please subscribe to the channel and give it a thumbs up and share it with somebody who needs it. That way I can keep creating content and YouTube can keep spreading it out. Okay, right now, let's look at the number of bottles in the medicine cabinet. If there are over 10, this is called polypharmacy. This is multiple medications being taken at the same time, and this means that they're over the counter as well as the medications that are prescribed. That's half the seniors in America, almost half the seniors take over 10 medications. Okay, so every medication is going to come with risks. When we combine 5, 10, or 15 medications, including vitamins and minerals, they multiply the side effects. In my practice in Kentucky, I saw most patients on multiple medications, and rarely were they in their 90s and living great social lives. But when I moved to Florida, I rarely saw patients on any medications, and they were living to 90 plus. I often saw patients in their hundreds. They were eating, they were exercising, and they were living incredible lives. Get my free medication safety and savings checklist so you can ask certain important questions to the doctors. It's all in that guide for you. So let me explain what happens when someone takes too many medications. First, there's drug interactions. Medications can interact in unexpected ways. One drug can make another less effective, or another can make it more dangerous and increase it. Another can cause dizziness. Sleep aids can cause grogginess. Pain medications always affect balance. And falls are huge in the elderly, and we definitely don't want that. Sometimes side effects can be treated with another medication. And now what we get into is this dangerous cycle of just keep adding medications. There's something called the rule of 10 in polypharmacy. And what that means is an elderly patient who takes more than 10 medications should trigger a review, always. These medications include vitamins, minerals, over-the-counter, and prescription medications. So here's what you need to know. These interactions are going to start increasing, and the risk is going to become significant. It isn't that this is just a hard and fast rule. Some patients might need certain medications, okay? But the key is the regular review and ensuring that every single medication is necessary. Here's the scenario that happens constantly. Mom sees a cardiologist, gets prescribed heart medications, sees an endocrinologist, gets diabetes medications, rheumatologist, gets arthritis medications. Each specialist is excellent in their own specific area, but they don't see the whole picture. They're not treating the whole patient. I saw this over and over again in the ER because what happens is we get fragmented medical care. So first thing is to create a medication list of everything, including the vitamins and supplements. Everything. Second, make a dedicated appointment with a pharmacist and go over all these medications first before you ask the doctor anything. Pharmacists cannot change the medications, doctors can, but pharmacists can give you the reason why you need to change that medication and then give that to the doctor. The pharmacist can also give you alternatives that you can ask the doctor about. So remember, as the patient, your senior, is aging, do they need the same dose that they needed 20 years ago? No, because their body is processing things differently. So the questions you're looking for are in this free guide, the medication checklist and savings checklist, okay? Also things we want to look at: weight loss, reduced sodium, regular exercise, dietary changes. These aren't easy, but they work. And implementing some of these changes to reduce the medications from 12 to 8 or from 8 to 5, is it worth trying? Absolutely. Functional medicine specialize in this approach. And functional medicine doctors are amazing at not prescribing medications, but healthy lifestyles instead. So start this week. Count how many medications your loved one currently takes. If it's more than 10, schedule that medication review appointment with the pharmacist. Don't feel embarrassed about questioning them. This is everything they love to do. Pharmacists love to consult with you. Nobody ever asks them these questions that I have in this free guide for you. And this is about improving the quality of life for your senior too. Remember, they might wake up, they might not be so fatigued anymore, tired anymore. They might just revitalize. I've seen this 100 times in the hospital and in my own family practice. So it's time to speak up. It is time to say, hold up. We don't need 7-minute appointments where you're going to keep giving medications. I want us to stop, and I want us to look at the whole picture. I do not want to feel overwhelmed anymore with multiple medications. Grab the free guide, ask the right questions, start with the pharmacist, pull everything out of the medicine cabinet and get this right. And if you like this video, go ahead and subscribe to the channel, give it a thumbs up, and pass it on to somebody who needs it too. Take care. I'll see you in the next video. Bye-bye.